Good day, learners. I am Mrs. Farinu Hemhe by name, one of the nursing tutors at the Lautech University Open and Distance Learning Center. So today we'll be talking about this course that is displayed right on the screen, Pharmacodynamics and Chemotherapy 1, also known as PHA 301. We'll be talking about study section 7, which is drug abuse and addiction. We have taken study section 1 and 2 about 3 weeks ago, and I believe my other colleagues have been able to teach you study section 3 to 6. So we'll be talking about study section 7 today, which is drug abuse and addiction. So let's dive right into the video. So what are the learning outcomes for this course? When you have studied this section, you should be able to define drug abuse and addiction. Secondly, you should be able to mention drugs that are commonly abused, describe various causes and risk factors for drug abuse and addiction to include the signs and symptoms. You should be able to explain the physical and psychological effects of drug abuse with the diagnosis and treatment. Lastly, you should be able to discuss complications, prognosis, and preventive measures for drug abuse. Let's start with definition of terms. What do we mean by drug abuse? This is the misuse of a drug, taking it in a way that is not medically intended or safe. So it can involve legal drugs like alcohol, prescribed drugs, or illegal drugs like cocaine, heroin, or cannabis. It may also be occasional or repeated, but not always associated with dependence. So for instance, when you take antibiotics without prescription, or drink alcohol excessively at a party. Let's move to drug addiction. What is drug addiction? So this is a chronic disease where a person develops compulsive drug-seeking behavior despite harmful consequences. So it involves physical dependence such as tolerance or withdrawal symptoms, or psychological dependence such as craving or loss of control. For instance, a heroin addict cannot function without taking the drug daily, and they usually experience withdrawal when they stop. Let's talk about drug dependence. This is a state where the body has adapted to a drug and stopping it suddenly causes withdrawal symptoms. So under here we have physical dependence and we have psychological dependence too. So when we are talking about physical dependence, that means the body needs the drug to function normally. Then psychological, the person feels they need the drug for their own well-being, but it doesn't always mean abuse or addiction. For instance, a patient on a long-term morphine, maybe for cancer pain, they may develop dependence, but they are not necessarily addicted to the drug. So let's move to the causes of drug abuse and addiction. Number 1, curiosity and experimentation. When someone is trying drugs just to see how they feel, this is common among the young people, the youth, because of their youthful exuberance. They want to try everything, they want to try something new, they want to experiment. Number 2, peer pressure. When there is influence from friends, classmates, or colleagues who are engaging in drug. Then number 3, stress and coping. Using drugs or alcohol to escape emotional, academic, or financial stress. Number 4, mental health disorders. So when talking about mental health disorders, it can be depression, anxiety, or trauma. So all this can push an individual towards drug abuse. Then availability of the drugs. So when there is an easy access to alcohol, cannabis, or prescribed opioids, this can make individuals to abuse drug. We have cultural and social influence. In some societies, drug or alcohol use is normalized. So people doesn't see it as abnormal. So everybody just have access to it. They can take it at any time because it is available. It is one of their beliefs. It is common in their culture. Then we have chronic pain or illness. You know, some people have chronic illnesses. So because of that, they are always on long-term prescription of painkillers or sedatives, and this may lead to misuse of drugs. So let's talk about risk factors. We have social risk factors for drug abuse and addiction. Number 1, peer pressure and influence. So this is one of the strongest factors, especially among adolescents and young adults. So friends or colleagues who use drugs can make the experimentation for them to be more easy. So when they have friends, when they have colleagues that are engaged in drugs, they want to experiment and know how it feels like. Number 2 is family involvement. When people come from broken homes or they have poor parental supervision, they experience domestic violence, or there is lack of communication, they have the tendency to engage in drug abuse. Then if parents or siblings abuse drugs or they have family members that abuse these drugs, children are more likely to do the same. Number 3 is socioeconomic status. Poverty, unemployment, homelessness, lack of education, all these increase the risk of drug abuse. Even sometimes wealth and excess income can also increase the rate at which people experiment drugs. Let's talk about cultural and community norms. So there are some cultures where alcohol, tobacco, cannabis is socially accepted. So the use begin earlier when people come from this kind of society. Then social gatherings and celebration may also normalize heavy drinking or drug use. So all these can actually influence an individual to abuse drug. Then accessibility and availability of drugs. So when you live in an area where alcohol is common or prescribed medications or strict drugs are easily available, this can actually influence you. Then when there is weak drug regulation, when governments are not placing enough regulation on a drug, or there is illegal sales near schools or communities, this can also contribute to drug abuse. Then we also have school and academic pressure. Bullying in school, poor performance, school dropouts, high academic stress can push students towards drug use. Workplace and occupational stress. There are certain jobs such as working in the health sector, people in the military sector, people in the entertainment industry. They have high exposure to stress. All these people that we're talking about, they go through a lot of stress. So there's tendency for them to use painkillers in order to enhance better job performance. Then number 8, social isolation or rejection. So when there is lack of social support, loneliness or stigma, all this can drive an individual to drugs in order to gain more comfort. So let's talk about biological risk factors for drug abuse and addiction. Number 1 is genetic predisposition. Some people inherit genes that make them more vulnerable to addiction. Then there are some with family history of alcoholism or drug dependence. So all this increases the risk. Take for instance now when there is variation in dopamine receptor genes. So this has been linked to addiction risk. Number 2 is brain chemistry. So there are ways in which drugs affect the reward pathway in the brain, such as the dopamine systems. Some individuals may have naturally low dopamine activity. So this makes them to be more likely to seek out substances for pleasure. Number 3 is tolerance and dependence mechanism. So when there's repeated use of drug, it causes the brain and the body to adapt. This adaptation leads to tolerance, that is needing more drug for effect. And then it can also lead to dependence. So when we are talking about dependence, that means withdrawal symptoms will occur if the drug is stopped. Then number 4, coexisting medical conditions. So when people suffer from chronic illness and they experience pain, maybe they suffer from epilepsy or other kind of illnesses which requires long-term medication, this can increase their risk of dependence because these people are going to be on drugs like opioids or benzodiazepines. Then number 5, age and developmental stage. So talking about this, adolescents and young adults are more biologically vulnerable because of their brains. Their brains are still developing, so they are more impulsive and they have less control on what they are doing. Number 6 is gender differences. Men are more likely to experiment and abuse drugs more than women. On the other hand, women may progress more quickly from use of drug to dependence and before you know it to addiction due to hormonal and metabolic differences. So let's talk about psychological risk factors for drug abuse and addiction. Number 1 is mental health disorders. So people with depression, anxiety, bipolar disorders, post-traumatic stress disorders, and schizophrenia increases vulnerability. Then many people use drugs as self-medication without prescription just to relieve symptoms. Number 2 is personal traits. Impulsivity, seeking sensation, having low self-control, and risk-taking behaviors. All this raises the chance of abuse. There are some people who crave excitement, so these people are more likely to experiment with drugs. We also have low self-esteem and poor coping skills. So individuals with low confidence, they may use drugs to feel more accepted or to escape from problems. Another thing is that poor stress management can also increase the likelihood of using drugs for relief. Then we also have history of trauma or abuse. So people who have been neglected as a child, people who have experienced sexual abuse, or they have been exposed to violence. All this increases their risk of substance use later in life. Then number 5, stress and emotional pressure. When there is high academic stress, there's financial stress, there's relationship stress. All this can push an individual to rely on drugs or alcohol as a form of coping mechanism. Another point is cognitive distortions. Beliefs like, oh, I can't cope without it, or just once will not hurt me. All these encourage continuous usage of drug. Then we have another point, which is previous drug experience. So when someone has experienced this before, maybe when you have a positive experience like euphoria, you feel relaxed the last time you used a drug, all these encourage repeated use. So what are the drugs that are commonly abused? Number one, we have central nervous system depressants. These are the drugs that slow down brain activity. They make everything in the body low and slow. So number one is alcohol. It's the most widely abused legal drugs. We have benzodiazepines, we have the barbiturates, we have the opioids like morphine, heroin, cocaine, tramadol, fentanyl. So they have a major effect on the body. So one of their effects on the body is relaxation, drowsiness, they relieve pain, they bring about euphoria. So they have a lot of risks like respiratory depression, they can lead to coma, they can bring about dependence, even death when there is overdose of these medications. We also have central nervous system stimulants. On the other hand, these ones speed up the brain activity. Number one, we have cocaine, we have amphetamines, we have the nicotine, we have the caffeine. What are their effects on the body? They make you to be alert, they increase your energy level, they make you confident, they bring about euphoria too. But what are their risks? They can cause hypertension, they can cause cardiac arrhythmias, they can make an individual to become paranoid, they can lead to addiction, even sudden death. Number three, we have the hallucinogens. These medications or these drugs, they alter perception, they alter mood and the way an individual thinks. We have the LSD, we have the psilocybin, which is magic mushroom, we have the mescaline, we have the phencyclidine. Their effect on the body is hallucination, they can cause altered reality, mood swings, and one of their risks is psychosis. It can lead to accidents. Another drugs that are commonly abused is cannabis products like the marijuana, the synthetic cannabinoids. Their effect on the body is that they also bring about relaxation, euphoria, they can cause altered perception, they can increase our appetite. And their major risk here is impaired memory. They can bring about anxiety, psychosis, even respiratory issues. Number five, we have the inhalants. So these are household or industrial chemicals that are inhaled for psychoactive effects. We have the glue, the petrol, paint thinners, aerosols, nitrous oxide. So we have people that inhale these products just to obtain pleasure. Effect on the body is that it causes short-term euphoria, it causes dizziness, it can have a lot of risk too. It can cause brain damage, it can cause sudden death. We call it sudden sniffing death syndrome. Most of these products are sniffed, so it can bring about sudden sniffing death syndrome. Let's take notes. Then number six is prescription medications. These are often misused outside medical supervision. We have the painkillers like the opioids, tramadol, oxycodone, hydrocodone. We have the anxiolytics or sedatives, diazepam, alprazolam. We have the stimulants for patients with attention deficit hyperactivity disorders like the methylphenidate, the amphetamines. So one of the major risks is dependence, overdose, and diversion to illegal use. So let's quickly talk about the signs and symptoms of drug abuse and addiction. We have the physical signs. So talking about the physical signs, there will be red or glassy eyes, there will be dilated or pinpoint pupils, there can be sudden weight loss or gain, there can be poor personal hygiene or neglect of appearance, there might be sleep disturbances, slurred speech or impaired coordination, there might be unexplained injuries, there might be frequent illnesses, there might be several needle marks on the body. If someone is using injectable drugs, there might be sleep disturbances, like I've said, like insomnia or excessive sleepiness. Then what about the behavioral signs? There will be sudden changes in friends or social groups, dropouts in school, poor work performance, there will be loss of interest in hobbies or responsibilities, there will be frequent need for money. Such an individual will be asking everybody for money, they will be selling their properties just for them to get that particular drugs. They can start borrowing without explanation. They engage in risky behaviors. maybe like driving under influence, they engage in unsafe sex, they are always violent. Then number 3 is psychological and emotional signs. There will be mood swings, irritability, they are always aggressive, they are anxious, they are paranoid, they suspect everyone around them, and there is an unexplained fear. They can even hallucinate, they might be delusional. They are always depressed, there's apathy, there's poor concentration, there's memory problem, there's strong craving for that particular substance. Then number 4, we have signs of dependence or addiction. So here there is tolerance. That means needing more of the drug for the same effect. Then they might experience withdrawal symptoms when the drug is not taken, like sweating, tremors, nausea, agitation, and seizure. So there is inability to cut down or stop despite repeated attempts. There is continued use despite harmful effects on their health, on their work, or on their relationship. So they have no control over it. They just want to continue. So let's talk about the effect of drugs on the brain. Number 1 is the reward pathway. We call it dopamine system. So most addictive drugs, they increase dopamine in areas like the nucleus accumbens and the ventral tegmental area. We call it the VTA. So this gives a high or euphoria, then reinforcing the desire to repeat that particular behavior. So over time, the brain reduces the natural dopamine production, and this leads to craving and inability to feel pleasure without the drug. Then number 2, we have the neurotransmitter disruption. So take for instance opioids such as heroin or morphine, they bind to opioid receptors. So through that, they reduce pain, then they cause euphoria. Then the stimulants such as cocaine or amphetamine, they massively increase dopamine and norepinephrine, thereby increasing energy, alertness, then risk of psychosis. For depressants, like alcohol, benzodiazepines, they enhance a neurotransmitter known as GABA, gamma-aminobutyric acid. So they bring about sedation, relaxation, but also impair memory and coordination. Then we have cannabis. So this cannabis now, it acts on cannabinoid receptors in the body. So they alter perception, they alter the memory and individual mood. So number 3, brain structural and functional changes. So that means they can affect the structure of the brain and the functions within the brain. So when they affect different parts of the brain, these are the results that you can see. So what is the effect on prefrontal cortex? There's impaired judgment, decision making, impulse control, because this is the part of the brain that controls all these activities. Then the hippocampus, there will be memory problem. Amygdala, heightened stress and anxiety. If it affects the basal ganglia, there will be craving and compulsive drug seeking behavior. So how do we diagnose drug abuse and addiction? Number 1 is clinical criteria. In psychiatric nursing, there's something we call diagnostic statistical manual. So under DSM-5, we have substance use disorder. A diagnosis is made if a person shows at least 2 out of 11 criteria within 12 months. So under this DSM-5, we have about 11 criteria. So if person shows at least 2 out of that 11 criteria within 12 months, then such an individual will be diagnosed of drug abuse and addiction. So one of them is taking larger amounts for longer than intended, maybe persistent desire or unsuccessful attempts to cut it down. Someone who spend a lot of time obtaining, using or recovering from drugs. It might be a strong craving for the substance. So we have a lot of them. So there are about 12 criteria. Then number 2 is the screening tools. We have different screening tools that can be used to diagnose drug abuse. We have the KH questionnaire for alcohol, which is cut down, annoyed, guilty, high hope. Now, we have the audit. The full meaning is alcohol use disorders identification test. We have the DAST, which is drug abuse screening test. We have the ASSIST, which is alcohol, smoking, and substance involvement screening test. Then number 3 is clinical assessments. Here they can take history, what is the type of drug that the person is using, the amount, the duration, the pattern of use. They can conduct physical examination, track marks, poor hygiene, is the person malnourished, has the person lost weight, are there signs of withdrawal? What about mental health assessments? They want to look at the mood of an individual, the memory, the judgment, are there signs of psychosis, are there signs of anxiety or depression? Then lastly, laboratory tests. So there are different laboratory investigations that can be carried out. They can do urine drug screening for the individual, which is the most common and the fastest. Then what about blood tests? They want to check the level of alcohol or opioids in the blood. They can take hair sample or saliva test for long-term use. They can also do liver and kidney function tests for organ damage. So let's talk about treatment of drug addiction. Number one is detoxification. So this is the medical management of withdrawal. So the first step here is that they are going to safely remove the drug from the body. So it is done under medical supervision to manage withdrawal symptoms. Example is alcohol. Benzodiazepines is given to prevent seizures. For opioids, they give methadone or buprenorphine to ease withdrawal. Even for stimulants, they can give supportive care like hydration, sleep, and anxiety control. They wouldn't want anybody to disturb such an individual. Then number two is the pharmacological management of drug addiction. This is more like medication-assisted treatment. So we call it MAT for short. So for opioid addiction, they can give methadone, which is a long-acting opioid agonist. Then for alcohol addiction, there is a drug we call disulfiram. So this causes a form of unpleasant reaction if an individual takes alcohol. So anytime such an individual takes alcohol, they feel a kind of terrible reaction. They start sweating, they start vomiting, they start stooling, having diarrhea at the same time. So this will discourage them from subsequent consumption of alcohol. So for nicotine addiction, they can do nicotine replacement therapy. They can also give them bupropion or varenicline to reduce cravings and withdrawal. Then number three is behavioral therapies like cognitive behavioral therapy, which is CBT. This helps to recognize triggers. What are the things that triggers them and make them engage in drug abuse? And this cognitive behavioral therapy also helps them develop coping skills. Then number two, we have motivational interviewing. So this encourages readiness to quit. We have the contingency management. So this is more like rewards for staying drug free. Then another one is group therapy and peer support. So we have different types of groups like Narcotic Anonymous, Alcoholics Anonymous. These are more like groups that they can join and also get support from them. Then we have the family therapy, which means involving their relatives to rebuild trust and support. Then number four is social and rehabilitation support. So under here we have vocational training, reintegrating them into school or work. We have housing and community-based support programs, aftercare programs to prevent any form of relapse. So let's talk about complications of addiction. What are the complications? We have physical health complications. There might be cardiovascular challenge like hypertension, arrhythmia, stroke, heart failure, especially when people consume cocaine or amphetamines. Then there might be respiratory issues like lung infections, chronic bronchitis, collapsed lung when people smoke or when they inhale substances. Then there might be kidney damage, there might be liver damage, there might be infectious diseases because their immune system will be suppressed. There might be a lot of neurological problems like seizures, brain damage, memory impairment, and so on. There might be psychological or mental health complications. They might be depressed. It can lead to anxiety. It can lead to paranoia. It can bring about drug-induced psychosis like hallucinations, delusion. There might be suicidal tendencies. There might be cognitive decline and poor judgment. Then there might be social complications like family breakdown, domestic violence, unemployment. There might be financial ruin. There might be problem with schooling, they drop out from school. There might be poor performance in their work, in their academic. They engage in a lot of crime. They have legal problems. There is social stigma and discrimination. So let's talk about how we can prevent drug abuse and addiction. Number one, we have the primary prevention. That is before the drug use starts. So these are the things we put in place before an individual starts using the drug. So number one is education and awareness, like school programs, health campaigns, peer education. All these are going to discourage people from engaging in drug abuse. Then parental involvement, when there is open communication, adequate monitoring from parents, adequate guidance. This will prevent youths or young people from engaging in illicit drugs use. Then another thing is healthy alternatives, such as engaging in sports, acquiring different skills, engaging in hobbies, things you enjoy doing. This is going to take young people's attention away from engaging in illegal use of drugs. And another important thing is policy measures. restricting people's access to drugs, banning underage sales, regulating prescriptions. So all this is going to help to prevent drug abuse. Then secondary prevention. So let's talk about the secondary prevention, that is early intervention. So this involves screening and early detection, using of cage, audits, DAST tools that we have discussed earlier. Then counseling and support, school counselors, workplace programs, all these can help in secondary prevention of drug abuse. Then targeting high-risk groups such as the teens. I told you that the young people, they are very impulsive, they are very inquisitive, they want to do things that their friends are doing. So when we target all these young people like the teens, the unemployed youth, people with family history of addiction, directly we can work with them and we can actually educate them on all the effects of drugs. Then lastly is tertiary prevention, that is after the addiction. So here we talk about rehabilitation centers where we can detoxify this individual, we can give them therapy, we can also reintegrate them into the society. Then we'll also be talking about relapse prevention strategies. What can we do? Here we can do follow-up care, self-help groups. So all this can help when it comes to tertiary prevention. Social reintegration, which is job training, let them learn new skills, providing housing, family therapy, and a whole lot. Then lastly, we have the harm reduction, all these needle exchange programs, supervised injection facilities, all these can help in tertiary prevention of drug abuse. So in summary, we have been able to define drug abuse, drug addiction, what are the types of drugs that are commonly abused. We have discussed causes and risk factors of drug abuse and addiction. We have also discussed how we can treat drug abuse. We have also discussed about prevention of drug abuse. How can we diagnose it? How can we manage it? So all these have been discussed in details under study section 7. So in case you have any question, you can drop it within the comment section and I'm going to answer all your questions. I wish you success as you prepare for your exam. Have a lovely day. Thank you.